Right, good afternoon. It's Andy Picken here from Royal Wellness at Chesterfield Royal Hospital. And this afternoon I've got Darren Vine with me from Westfield Health. Hello, Darren.
Andrew, how you doing?
Yeah, I'm not bad, not bad. It's quite a nice day as well, isn't it? It's sunny.
Nice.
It always helps. So anyway, thank you very much for joining us. This is part of our YouTube channel. And really what I've got Darren on to talk about is the exciting Westfield Health programme. And it is exciting, isn't it, Darren?
It is, yeah. Yeah, I think there's lots of things. It's very unique what we're doing here with Chesterfield Royal. So in terms of Westfield, we've kind of been working with companies for years, and we've got over 9,000 companies that we deliver face-to-face or remote wellbeing services for. So, but we don't just kind of put it out there. We do all this stuff through the AWRC at Sheffield Hallam as well. So it's all evidence-based stuff as well. So we're kind of taking that expertise now and building a program with yourselves to try and get people, more aware of the health and well-being, more aware of the fitness goals and what they might be able to do about that, and just get people active and moving, really.
So that's great. So in terms of accessing, Darren, because we've made it really easy for people to access an exciting and different, unique health and wellbeing program. And certainly in a hospital environment with the challenges we've got, there's never been a more important time for people to look at their individual health. So I suppose, first of all, it's an app-based, technology app-based system, but people get access once they join that in a one-to-one with you. And so it's a personalised health and wellbeing program. So just take us through what people need to do from the welcome email that we'll send out.
Okay, so the welcome email will direct you via the App Store, where you can go via the link that we provide, and then that will, if you're on site at Chesterfield Royal and you go through the app, then that will take you direct to Chesterfield Royal Hospital, the specific app. If you do that away from the hospital and you go via the App Store, you will just go onto the normal My Wellness, and then you won't be on the Chesterfield Royal one. So make sure that if you're going in via the app on the welcome email that you're on site. Now, if not, there's a link on the email as well, which you can go through, which again, if you click on that and go straight, that will take you straight through to the Chesterfield Royal Hospital site. So just, yeah, it's really specific, but if you make sure that you read the welcome email and just follow those instructions, it's pretty straightforward, really, and it'll take you straight through. You can register. If you go onto the app and register, then within 48 hours, we'll approve that access for you. So you'll not have full access until it's been approved, and we'll just double check people's eligibility, make sure we've got everyone who should be on there doing the things and all get access to it. And then as soon as you get that access, you've got full access to everything that's on the app.
That's fantastic. So crhft.wellbeing@nhs.net. There'll be a little subscription link that I'll put in this video as well. So just use that to get the welcome email, and we'll send that out initially. So it sounds really exciting. So people get access to the app, whether that's 48 hours, there'll be an approval process, and then they can make a direct contact with you, can't they, Darren? And you can have that initial conversation where they will go through a little physical activity questionnaire, if you like, and then we can get them up and going with the program as soon as we can, really.
Definitely. So yeah, so when you go on there, you can go into the class timetable section and you can click in there. Now we're doing appointments on Tuesdays and Thursdays at the moment, up until Christmas, and then we'll revise it and see what we need to do beyond that. So yeah, you can book a 15-minute one-to-one with myself. It's a virtual session, so you go in through the app, you book it through the app, you go on there through the app also as well. And chat, like you say, we'll go through whether you're ready for physical activity or not, just to kind of go through the make sure that everyone's healthy to do that and make sure everyone's safe. And then we'll have a chat about the app. I'll go through the orientation, so we can go through all the different sections and the functionality. I've spent quite a lot of time on there recently, and I find it a really easy app to get around. I'm sure the people who are already signed up are finding the same thing as well. And then we'll just have a chat about your health goals, your fitness goals, and what kind of stuff we can do and how the app will support you and maybe motivate you with that stuff. And then, up until Christmas, we'll be doing inductions with people, but then encouraging people in the new year to maybe book in a second session. Hopefully, by the time the new year comes, we've made a lot of progress, and we can get our trainer on site for 2 days, which is part of this program, which would be great.
That's brilliant. So you've said a lot there, and I think what's really important and crucial about this health and wellbeing program is it's bespoke to the individual as well. So obviously everybody's got different goals and a vision of what they want to do, and I think people are more aware, especially through COVID, that they maybe not be moving as much. Maybe the mindset, the motivation's dropped off. Certainly since summer, it's winter nights, it's January, February. So really those New Year's resolutions, January 2021, the new me, new you, new year. Hopefully there's a vaccine in place as well, so things are looking up and you're really driven, and this program can support those goals, can't it?
It can. Well, we've got general stuff on there that we've got. For example, we've got a challenge at the moment called Moves into 2021. Now, moves are techno gyms. They kind of allocate points towards how much you're moving. So we've put one on there just to get people used to that functionality, to get them using it. And then we've got the capacity to change and update these challenges. So if anyone's got any ideas, that'd be fantastic. Let us know. And in the new year, we'll put some new challenges on there. As well as that, we've got things like tailored programs, which you can go into, where you answer a few specific questions about how often you want to exercise, how long you can exercise for, etc., what you're exercising for in terms of your goals. And then that will come up with suggested workouts and exercises for you. So as well as having the general stuff, we've got the really specific stuff there built into the app as well. There's also YouTube pre-recorded activities and sessions that you can join in with and have a go at. And then hopefully when we get our trainer on site for them 2 days, we'll be doing some live sessions through the class timetable as well and building that into the program. So there's lots of functionality and lots of things you can have a look at, and it can really support you through the app, just in general terms, but then really specifically and nailing things down for yourself, really. And that's where we're kind of hoping it goes in the longer term.
Sounds fantastic. So there's some serious health and wellbeing subjects that it touches on there, but principally it's fun as well. It's at your fingertips. You can click on. It's a seamless integration link in terms of booking you, and in terms of on-site activity. Woohoo! Where's that gone over the past year? We might well have people in person there doing a fitness session or a walk, or the really important things are just moving more. So hopefully as the program evolves and COVID lifts, we can really get down to some of the fun stuff, collective stuff, where people can get involved and be involved in fitness exercise sessions on site.
Well, exactly. And there's lots more we're trying to build into the program as well as we move forward. So hopefully when we can get on site as well, we can do some health screening, some health checks, so people can get an idea of what their current level of fitness and health is. We can, repeat them further down the line and do some comparisons, which would be great for people trying to build on their fitness and health and well-being. We're going to have them live workouts, like I said, and then we've also got other things that we've got available to us. So we've got the wellbeing plan, which we're making available, where you can log in and you get information. So it's another online resource, but it supports your health and wellbeing. So looking at those, how to eat more healthily, how to move more, how to sleep better, so that kind of stuff as well. It's got personal training plans on there. It's got videos on there. It's a great resource to supplement what we're doing as well. And another thing as well that we've been discussing, Andrew, is maybe doing a monthly webinar program as well, and maybe doing that to support. Yes, we've got the fitness side of things with the Technology Map, which is fantastic, but then also having that well-being package as well that goes around it. So we've got the whole holistic kind of approach to things, which I think will be fantastic.
And that's why I think, this has been funded by the hospital charity, for example. So it's a real statement of intent and investment in providing opportunities for staff to take control of their own health and well-being, in which, as we said, is one of the first of its kind in a hospital. And I think it's a real statement of intent. So it's an opportunity, guys, to get involved and really be in the driving seat of your own health and well-being, physical activity, and the mental health and well-being and the coaching-led style sessions as well. So there's a lot to be added to this program, and I'm really excited about it. So in terms of the challenges, lifestyle goals, we mentioned the one-to-one slots, the tailored support. We're also probably going to add some things as we go along as well. So we mentioned challenges, we mentioned the moves things, we mentioned maybe awareness campaigns throughout the year. There's certain things that we can dovetail with. So hopefully it'll get everybody involved and we get that spirit where people push each other along as well.
Exactly. And I think the first point is let's get as many people on the app as we can.
On it.
Get people using it, get people moving, get people active, get them familiar with that technology that we've got out there. And then the more things we can supplement in, and we can build this program as we're going, can't we? So if there's specific things that people are, like, for example, I had a one-to-one the other day and someone was suggesting to me about a flexibility program. So we've gone away and we've put 2 flexibility workouts onto the app. So any ideas that people have or anything that people would like to see on there, if we've got the capacity, then we'll do it and we'll build this program and make it really bespoke for Chesterfield Royal.
I'm really excited about it. I love stuff like that. Flexibility, I think I'll sign up for that, Darren, as well. It's not one of my strong points, to be honest. And I suppose we no interview or conversation would be complete without mentioning COVID. And in terms of physical activity and mental health as well, and the effect that this pandemic's having on us, we're doing quite a lot of work with helping people take control of their own lifestyles, which will have a beneficial effect in terms of resilience or bounce back ability and boosting your own immune systems through looking after yourself. So basically you can reduce your COVID age risk, if you like, by lowering your blood pressure, losing a little bit of weight if that's the issue, addressing mindset and resilience and calming and things like that in these challenging times. So there's a real benefit to this, isn't there, and especially important in these times. Definitely.
And I think one of those things is we've all been more static and more sedentary, haven't we, these last few months?
Absolutely.
With all the best intentions in the world, we might be more active in the summer, but it's harder now in the winter months. So anything we can have to kind of motivate and supplement what we're doing is great. So yeah, just get yourself out there, get more active, try and get engaged in what's going on, and take these opportunities that your employer is obviously a great one who supports you and offers lots of things for you. So get involved, do as much as you can, get yourself moving, and just by moving more and doing it more regularly, you're going to get health benefits that are going to feed into all different parts of your life, not just work, but your home life, your social life, your personal life. And then, yeah, the benefits, I don't need to tell people who work in a hospital the benefits of being fit and healthy, but, you know, we're trying to put as many things in as we can to support that and to make those opportunities easier to access. And I think this program's got some in there for everyone to get involved with.
So that sounds brilliant. We've covered quite a lot there. In a nutshell, we've done this video really, haven't we, to sort of, just have a little pause from the emails and have just an informal chat. So I appreciate your time with it, Darren. So just to reiterate, people have watched this thinking, you know what, I'm up for this, and they make that first step. So I suppose the email address that will be on your screens now, do email that. A welcome email will be sent out. Darren will be notified once you've registered your details upon that, and then you will have to wait a period of time. You'll authorise it, and then you will have access to all the features on the app, including booking that one-to-one with you, Darren.
Yeah, but you're not until it gets authorised, then you can't build what you one-to-ones. So just 48 hours. That's the longest it's been, but it's normally done. It's normally done the next morning or whatever it is. So yeah, we get through it pretty quick.
So, Darren, thank you very much for your time. I think that's been fantastic. We'll put a bit of information on after this video, but I suppose the closing words from us is let's get involved, let's get active, let's take control of his own health and well-being, and it's an exciting program, so get involved.
It is, exactly.
Brilliant. Thank you for your time. Thank you.